So within behavioral science, the research has shown again and again that people often make decisions intuitively, without a lot of effort or without a lot of thinking, and quite often with very little conscious awareness as well.
Hi, I'm Tabinda Anwar.
And I'm Jubeira Masood.
Welcome to Solutions Cast, a podcast series hosted by Innovation-AccLab Pakistan. In this series, we want to understand the disruptive impact of COVID-19 and also talk about the local innovation and solutions that the crisis has accelerated. In this episode, we'll talk about how behavioral insights, especially while communicating in a crisis, can bring a shift in decision making. How can we use perception polls to gain deeper insights into people's behaviors? What are behavioral insights? And how can we use this approach to improve lives? These are some of the questions that we will be exploring with our guests. With me, I have Dr. Umer Taj, who is Behaviourial Scientist. Dr. Umar, if you could please introduce yourself briefly.
Sure. So thank you very much for having me here. Tabinda mentioned, so I'm Umar. I'm a behavioral scientist and I work at the intersection of academia and practice. So my interest is in applying behavioral insights into practice, which means working with governments around the world or international development organizations to try and bring social impact.
Okay, thank you. And we have Bilal Gilani, who is an executive director at Gallup Pakistan. Bilal, please introduce yourself briefly.
Thank you so much. I work at Gallup for about 12 years, and I have a background in political science and international relations. But my experience at Gallup has been running survey works for different organizations, including a lot of third-party evaluation, political polling, and generally social research.
Okay, thank you. Welcome to the podcast, Dr. Umar and Bilal.
So maybe, Bilal, we can start with probing a little into what BI means and how a lot of the times it's dependent on people's perceptions and how a lot of the times, behavior, psychology, social psychology experiments are taken as something very minute and not really incorporated when taking decisions. So you guys at Gallup did an opinion poll, which was around COVID-19. Can you tell us a little about why you did it and how you initiated the polls?
Yes. So we, as a public opinion polling company, really believe in the primacy of giving voice to the public. So, I mean, the public opinion part in the public part is really crucial. For us, democracy cannot function till the voice of the people is heard. In the COVID times, when everything becomes in a crisis and everything is, held in a constant, the voice of the public is difficult to be heard. In this particular scenario and in general scenarios as well, public opinion polling provides a tool for policymakers, for the government, for people in general as well, to hear what a collective voice of the society is on issues that matter. So we started the project on perception tracking of the general Pakistani population related to COVID-19 as a project to give voice to the voiceless Pakistanis who were in the quarantine, who were spread across 200 million people, and therefore their voices were not being properly conveyed to where the power corridors were. So this was a major rationale, but the ancillary objectives was to also provide decision makers with facts and figures, a tool for empirical decision making, and also to provide a continuous stream of data that can act as a monitoring and evaluation tool, a third party evaluation voice for different initiatives in the economy, in society, in health, in COVID-19 itself, through vaccination and other interventions that were happening. So these were the three key objectives: giving voice to the people, making decision making empirical, and to provide a continuous monitoring and evaluation framework for the government initiatives.
Okay, thank you. I think our listeners would be interested to learn also about like what are behavioral insights, or BI for short, and application of BI. Dr. Umar, my question to you is, can you tell us a little bit about that? And you've been working across the globe, and also do share some examples of BI work that you've been engaged in our life before COVID.
Sure. Most definitely. So behavioral science is, or behavioral insights is a term that is becoming increasingly popular, but its roots started in around 1970s, and a lot of the insights and methods, they are drawn from research that has already taken place in fields of psychology, economics, and neuroscience. And fundamentally, what behavioral science has done is it has challenged this view that people always behave in their rational self-interest. So within behavioral science, the research has shown again and again that people often make decisions intuitively, without a lot of effort or without a lot of thinking, and quite often with very little conscious awareness as well. So behavioral insights, in short, you can think about it as is this body of knowledge that is informing what are the factors that influence behavior change. Just to give you an example of the kind of things that have been done, and I'll share a few. So let's start with this one insight about, and it's related to salience, right? So we are more attracted to whatever attracts our attention. And here's one example where an organization wanted to increase response rate to surveys. And that's something which I think across all kind of domains is something we would want. And here's the way that they used the insight was that they just added a post-it note to the survey itself and just a handwritten message. And that just in itself, this post-it note with a handwritten message, doubled the response rate. One other example then that we can use around is really interesting. So this is what behavioral insights offer, which is a different lens. So we all know that incentives generally do work. But here's the interesting thing, which is, so there's this behavioral insight, it's called loss aversion. The insight is that we tend to value losses twice as much as the gain. So imagine losing, let's say 100 rupees versus you are given 100 rupees. The pain of losing 100 rupees is almost twice as much as the pain of, as the joy of gaining 100. And so just using this phenomena, there was this one study where they tried to incentivize teachers based on the performance of their students. And what they did was, to one group, they said, okay, well, if your students do well, by the end of the year, we're going to give you X amount of money. And to the other group of teachers, they said, well, here's this X amount of money. We are already giving it to you. If your students reach a particular target, then you will just get to keep it. But if they don't, then sadly, you will have to take it away. Now, in essence, if you think about it, they're exactly the same. Only those teachers are going to get the money who meet the certain performance requirement. But in one, they're only going to get it after. In the other, they got it first, but if they don't reach. And just this improved the performance of the student 4 times, right? So again, there was the same amount of money that would have been given, but just thinking about when to present that brought about a big difference. And I think maybe just one more that I can use just to give you an idea about this. So if we go back to here's an example on on vaccination, so getting parents to vaccinate their kids. And quite often the intention is there, but somehow people don't end up carrying out that behavior. And in this piece of work, the behavioral insight was around getting people to plan. So they created this calendar and they went home to home and they actually gave that calendar. And the person who would give the calendar to the parents would ask to mark down the date and the time when they think they would be able to go, and they would request them to hang that calendar on their door. And just this act of planning that, yes, next Sunday, I think I'm going to go around 10 o'clock, and then marking it on the calendar, just that in itself increased the number of number of parents who then went on and got their children vaccinated. So these are just a few examples. The basic principle is understanding the way our mind works, trying to leverage these behavioral insights and develop very low cost solutions, easy to implement solutions, which themselves are what people would want to do as well.
And these interventions that we have, based on these behavioral insights, we call them nudges.
And yes, a nudge is quite often a label that is used for interventions that are using behavioral insights.
Okay, thank you. Bilal, my question to you is that you've mentioned that Gallup Pakistan has a weekly tracker of opinion polls. I'm curious to know, mostly from the recent polls, what has been some of the deepest insights and trends?
Yes, thank you so much. So apart from just doing the public opinion polling, we've also been polling other segments of the society because their voices are also crucial. So, for example, we recently completed a survey of doctors in the country, the frontline workers, as we call it in the report. We also looked at the voices of students, because the student community has also been impacted because the universities are closed. We looked at students who are in the school community and are now either studying from home or are exposed to the tele-school initiative. We've been working on understanding the pulse of the businesses in the country in order to understand where they stand in terms of their economic situation with respect to employment that they're offering. So the public opinion is not just restricted to the public at large, but also segments of the public that we've been targeting. I have 4 key points that my learning through the public opinion data across the different publics that we've been studying for about 4 months now. And I thought they provided a good insight, a window into understanding the Pakistani public and to some extent the public experience across the world as well. The first one being that the public follows leadership and is very sensitive to how the environment around them is. This is to some extent also a learning from the behavioral economics field, that people are not rational. They are also impacted by the environment that they are living in. So we followed how people's perceptions across on the issues related to COVID changed. So right in the beginning, when the government was ambivalent about lockdown, we saw that the support for the lockdown in the public was also low. And when the lockdown was imposed, and it seemed that the entire leadership in the country was behind lockdown in a major way. The highest we had in one of our weekly polls when the lockdown was continuing, about 78% of the people saying that the lockdown was something that was required and needed. And although they were suffering economically, this was something that they were willing to suffer because this probably offered a long-term solution and a quicker solution. And then we started seeing how generally the lockdown situation in the policy or at least at the government level, the consensus started to move away from the lockdown and towards smarter lockdowns or more other forms of implementation of SOPs. And then the support for lockdown started to fall. And in one of our, I think the fifth wave around after the Eid that has just passed, we saw that the support for lockdown had gone to single digits, and most people were not in favor of lockdown. Another key learning for us was that the impact of COVID-19 was operating in very strong power hierarchies. So the impact was the most felt and the most aggravated for the lowest in the power hierarchy. And it was that particular segment of the population that had the lowest voice in the power corridors. So we looked at how employment in the country was being affected. So in our polls, about 1 in 2 employed people were saying that they have either been let go of or completely, or they have been sent on a paid or an unpaid leave. And we looked into it and we saw that people who were well to do, or people who were being paid significant salaries, this phenomena was only 1 in 10, whereas for the lowest paid employed person, the phenomena was as high as 7 in 10 were saying that they were unemployed. So for us, the learning was that in the public policy operates in significant shades of being successful. In the interventions that we design, we need to be very conscious of the hierarchies of power that exist within the societies that we are operating. And unless we think through those hierarchies that exist and try to penetrate and to create solutions to those hierarchies, the hierarchies will then emerge themselves in the solutions that we're creating. And the last one being that there has been enormous success in media communication with respect to COVID-19, but then it operated in pockets. There were some left out pockets, and those left out pockets were areas that were not digitally connected. And we saw that one shade that really penetrated through all was not being digitally connected. So rural people in certain communities, in certain provinces, people above the age of 50, they tended to have less success. The government tended to have less success in being able to reach out to them. So digital hierarchy or digital divide was also a very crucial learning that through when we look through our data, we could see that to be a very important one.
Very interesting things you've shared, both of you. And Bilal, Abhi, when you were saying, intentionally designing interventions to also then tackle to these kind of complex problems of hierarchy, which obviously has been there for forever. These are not things that have just come to surface. These are very systemic, elements that have existed. So how can one be intentional by when you're designing these interventions and you're using BI? So how can you intentionally design something where you can actually change something?
Maybe I can talk briefly about this, and Umar can shed more light from international experiences in designing interventions that cater for these. For us, over the past 4 decades that we've worked with policymakers in order to design policies that look through and adjust themselves to these existing hierarchies, we advise two significant steps before the interventions start to happen. One of them is to do exploratory research about the subject and about the target market that one is looking to intervene in. That the research doesn't necessarily have to be primary in the sense of collecting fresh data, but it can also be secondary about existing data. So when we're talking about intervention geared towards making people comply to SOPs with respect to COVID, we have a identified target market or a target audience, and we really need to first understand that target audience in terms of demography, in terms of social indicators, psychographic indicators, and anything that we can do to understand our target market well before we actually start to think about them. So a lot of design thinking, essentially, and its principles are a crucial first step into designing interventions. The design thinking, for example, provides a great step-by-step guide into thinking along those lines. And the second is a lot of testing before actual implementation starts to happen. So testing provides an opportunity to make sure that the voices of the actual people who would be exposed to such a message, or actual voices of people who would be exposed to these interventions, would have to live with them, for example. We spend significant time with them, quantitatively as well as living through with them qualitatively. It doesn't necessarily have to be very large samples. So with these two intervention points, doing a lot of exploratory research before thinking about the intervention, and then when prototype of an intervention is available, testing it significantly, so we are able to make sure that we have a good understanding of where we are doing it, why we're doing it, and how it could be perceived. This can help. This can really help. It doesn't offer a sure solution, but it definitely does help um, uh, to to create interventions that are well tailored to the segments of society, and is cognizant of the hierarchies that we would eventually encounter. As you rightly said, these are not created; these are existing over centuries. And but I'd be curious to hear what Umar has to also contribute to this, and how the BIA solves this puzzle for policymakers.
Sure. So I would certainly agree with both the points that you said. Um, I think a couple of additional points that I would like to add are, so first, co-creation. So I think this kind of an exploratory thing, I think that itself lends well to this idea of co-creating solutions with the people for whom you're trying to create an intervention for. Um, I think the use of behavioral insights goes into the methods that you're using to understand. So we want people to do X, for example, and to figure out, well, why aren't they doing X? I think what behavioral insights provide is this vocabulary and perhaps some sort of a guide as to what are the things that we should look out for. I think that's one. The second bit is around diversity when it comes down to generating solutions. So quite often, the reason that we still have interventions that work very well for one sector of the hierarchy and not for the other is just because people who are creating the solutions are also probably from that one level of the hierarchy. And therefore, their view of how the world is totally influenced by people around them, people who they know. And I think that, so within the BI domain, we call it the curse of knowledge. This phenomena that you have been working on it for a while, and you have this perception that the actual out there world is very similar to the world that I know. I think this also exacerbates this problem of interventions that might only be helping one level of the hierarchy. So might just come down to simply realizing that, so why are we only thinking about delivering message through X? Uh, we do know that there's already this big network that's out there. Well, why have we never thought about using that network? Because it already communicates with that target audience. So we miss those quite often just because it's always the same group who's trying to think of solutions, and the new voices usually doesn't come in, who can sort of have this outside view and just listen and say, oh, why haven't you ever thought about doing this? So these kind of questions are really important when we are developing interventions.
Okay, thank you, Dr. Umar. I'm glad that you're sharing about this, because I know that you have been working very closely on applying behavioral insights to risk communication for COVID in Pakistan. Can you share some examples of your work with the wider network where you've applied BI to shift perceptions and improve decision making?
Sure. So just generally, the application of behavioral insights within curtailing COVID just across the world has all been focused quite a lot on communication.
Yes.
So it's stuff like, how are we communicating? Who is communicating? And then the things that we want people to do, how are we presenting those options, etc. So in Pakistan as well, I've been involved is a little bit into helping people think about all of this communication that is going around. So very specifically, it's thinking about the content, the delivery, who is delivering, and then the third is the channel. So how should it be delivered? So some examples are, there has been a ringtone message that, so for those who are in Pakistan, they would have definitely, almost certainly would have heard that message. But for those who are outside Pakistan, just for them, when you call somebody on the phone, while it's ringing time, you could play a message. And so in Pakistan, that's one thing that has been going around. So when you call somebody, a message starts until the other person picks the phone. And so I've been working with a team to try and share some insights on how to frame that ringtone message in itself. So some of the things that we already know from behavioral insights, for example, we do know that fear-based messaging doesn't work. So it has to be more around self-efficacy. So our disgust-based messaging probably works. So we've been trying to avoid fear-based messaging and trying to put more idea that you can control these other things. Second is about we are more likely to take action that if as a result of which there is consequence for our family. So if we tell people do this because you're gonna get hurt, or if we tell people do this because your family might get hurt, people are more likely to do the action when we tell them that their family might get hurt. So one of the things we're trying to do is to shift this focus and saying, well, actually, we want you to do these things not only for you, but it's actually for your family. The second is around helping the digital campaign that is being run with the help of UNDP and other UN agencies focusing specifically on youth. So again, within that, it's around the content that gets created. So there are videos and the kind of insights that we could show in those videos. Just to give you one example, for instance, we need to visualize the virus, right? It's quite hard when it is invisible to show, well, how it spreads. And somehow bringing this visualization just through the use of colors and that actually helps people understand, so this is how it would spread, this is why I need to do X. Or just explaining people are more likely to do a particular action if we give them reason why not. So a lot of times we only instruct, we don't increase their knowledge. So explaining first, this is how it spreads, therefore the action is wear mask, etc. So another one is around robocalls. So and this has been happening in some provinces where robocalls, people would receive that with a message. And what's quite important, and this is something which we have learned, and again, Bilal, Gallup has their surveys are showing again and again, which is who are people listening to most when it comes down to messages related to COVID. And it's overwhelmingly, so it's I think around 70% or so is doctors. So people are most likely to listen to a message when it is delivered by a doctor, which is really important. So when you're delivering a message, having a messenger. So who is the messenger? It's a really important point. So when you think about robocall, what's important is who is it coming from? And so been doing some work to inform one who it should come from, and then again, what should be the order. So for instance, when it is a robocall, you can just hang up right away. So the first thing that we want is for people to just hold on and listen to it, which then means that the most important information has to go right up front, and it has to capture their attention. So doing some work around or doing some thinking around what it is that should go right up to capture attention of people. And I think the other bit then is just thinking about communication channels. So which is we just to give an example, for instance, we already know, and again thanks to Gallup, and this the idea that the thing that Bilal was talking about, which is informing, having evidence-based decision making. So we already know that the communication channels that have the most reach are television and mobile phone, right? Now the issue is, if you were going to go with television, it's really expensive. So then comes the question, well, what can be done? And here's an interesting one that I've proposed to the Ministry of Health, which is that every day you have a daily press briefing, which means that there is you already have free space to put a message out, which is at the background of where people are speaking, and then also in front. So if you imagine a press briefing, you have the person, but you have the background wall, but then you also have the space in front of the table. And it's just thinking a little outside the box, which is, well, we know TV has the biggest reach. Well, how we know it costs, but is there a way? And so it's things like these which aren't really behavioral insights, but which is just thinking a little outside the box. And there are possibilities definitely that we could work with. And again, the key insights were, one, fear-based messaging will not work. We already know it from literature. The second is we need to be very, very specific. So as soon as you give some sort of an ambiguity, then it would give more of a chance for people not to do something.
Okay, thank you. Bilal, my question to you is that from Gallup's, the perception studies and the insights that have been gained, and I want to know more about how, as we say, closing the loop. I know Dr. Umar has mentioned some examples where Gallup's perception surveys have been used, but I want to ask you as well, that were these insights used to inform any decision or response work?
So our different studies have been used at different levels. I think one of the crucial areas where the data has been used is the media communications part. So our current work and our past studies around media habits of people have come in very handy for communications purposes, in order to understand who is listening to what medium, and to what extent and at what times. So if one is targeting someone in the KP rural areas and within the age bracket of 18 to 30, what's the most appropriate vehicle to use? So we've seen our works being quoted by, for example, UNICEF, which is working around reaching out to populations. We've also seen our work being quoted by the Ministry of Health. and other humanitarian organizations working on this. So we did a couple of studies on how the labor force in the country is being impacted, and how the household economy has been impacted. I talked about employment, for example. We've seen the data being used by the Ministry of Economics, and we've also seen a minister using the numbers on the floor of the parliament, citing numbers and justifying the policy decisions that they were doing. So that's that for us. That's one intervention point, and the objective being met. That a decision is being made by the policymakers, not in the darkness of lack of empirical data, but data being used and decisions happening.
Yeah, that's true. That's true. Thank you, Bilal. So at UNDP Pakistan, the Innovation-AccLab mainstreams innovation in a country office. One of the work streams is building innovative keys and introducing innovative approaches in our programs. My question to Javeria is that I want to ask you, what is Lab's vision on including behavioral insights and expanding our toolkit of innovative approaches?
So maybe before I answer that question, I can hint on some of the things that are already, part of the toolkit before this further expansion. So a lot of design practices, like Bilal also talked about design thinking. A lot of our practices and a lot of our deep exploratory work is very heavily embedded with the ethnographic praxis. Essentially, that in itself is, study and understanding of people and their context, to identify why somebody is saying something, where they're coming from, what are some of their influences, not just in terms of environment or people, but also a lot of cultural nuances that we follow. So it's a lot of the times, often, after these understandings and deep dives into these social psychology domains is when we start figuring out that for which project or which stream of portfolio do we need which methodologies, right? So toolkit is just the apt word for it. There are a lot of offerings like, design practices of design thinking, there is systemic design, there's strategic foresight, and they all interlink. So it's often not that just one is picked. All of these tools and methodologies have an undertone of each other, and specifically the behavioral insights frameworks. But what's really good now is that we're kind of also taking BI as a separate offering, in a sense that a lot of the testing that Umar and Bilal talked about, there's a lot of emphasis now on that. That even before you are now proposing an intervention, which is very well supported by all the ethnographic work, you should test it. So whether that is through, perception surveys, or that is through focus groups, or, different tools, or even try to figure out that are you even able to reach the larger audience if there's a digital divide, or a collapsed or an incomplete infrastructure around that. So then what are the BI tools, or what are the design practices that you can incorporate? So, like you said, that one of our mandates at the Innovation-AccLab is to mainstream innovation, and a very strong element of that is to build capacities. So not only are we, reaching out and identifying traditional and non-traditional partners who are doing interesting work, such as what Bilal and Umar shared, and I'm so glad that they, very clearly, explicitly used a lot of examples to really deconstruct and help us understand what each of those means in terms of technicality, what were the tactical aspects, what were the strategic aspects of it. So this again also helps us largely inform our audiences, our partners, our friends, and the larger community. So our vision really is to build a community, mobilize community, and have this community of practice around it.
Okay, thank you. Dr. Umar, Bilal, Javeria, thank you so much for your time. We'll continue to follow the perception polls by Gallup Pakistan, and we're working closely with Dr. Umar at UNDP Pakistan. To our listeners, thank you for listening. This is Solutions Cast. Thank you, everyone.